Hello, thank you for joining us for this webinar, Policy Systems and Environmental Change Strategies, Part 2, Environmental Change and Programming. My name is Mary Ellen, educator at Hamilton County Public Health, and presenting with me is
Anna Smith, a health educator at Hamilton County Public Health as well.
Excuse my voice, I'm getting over a cold, so I'll try not to cough often during the webinar, but we'll go ahead and get started. So just as an outline for the two presentations, so like I mentioned, this is part 2. In the first part, we covered policy and systems change. If you were unable to participate in that webinar, you can watch it on the We Thrive YouTube channel, which you can also access from our website, which is www.watchusthrive.org. So feel free to check that out and listen to that webinar as well. So today we will talk through environmental changes and programs. So we're going to start with kind of definitions. So these are the same definitions that we started with in the first webinar. So as we talked about policy change last time, we talked about interventions that impact law, ordinance, resolution, mandate, regulation, or rules, be them formal or informal. They are usually written down in some form or fashion. When we talk about systems change, we're talking about interventions that impact all elements of an organization, institution, or system. And typically, we are changing the way things are done within that entire organization. Often, we see that system changes are the implementation of a policy change. When we're talking about environmental changes today, we are talking about interventions that impact the physical changes to the economic, social, or physical environment. So these are changes that you can see, touch, or interact with directly. And then lastly, as we talk about programs, we're talking about events, classes, direct education, or other things involved working directly with the community to change behaviors or increase knowledge. Things like exercise classes, recycling events, or other one-time or limited run events. Oftentimes, as we're talking about policy systems and environmental changes, there can be overlap, and that's okay. You know, a policy change could lead to an environmental change. An environmental change could lead to a systems change. So just kind of keep that in mind. It's okay if there's some overlap among those as well. So again, if you joined us the first time, this should be familiar, but this is the health impact pyramid. The health impact pyramid visually depicts the impact of different types of public health interventions. At the top of the pyramid is where you have the greatest impact on individual health. And at the bottom of the pyramid is when you have the greatest impact on population health. So that very top of the pyramid, you have counseling and education, which are important and very much needed in this work, in the work that we are doing. But they also require a lot of time, and it's typically a one-on-one intervention or a small group. The next thing down on the pyramid is clinical interventions, which includes things like treating health concerns with prescription drugs or other medical interventions. These interventions can reach a slightly larger group of people than counseling and education, but still require the individual to wait for them to develop the disease before you can begin treatment. In the middle of the pyramid is long-lasting protective interventions. This includes things like vaccinations, screening, and other interventions that help prevent disease. But still, people are required to do something or make a choice in order to benefit from these interventions. As we'll talk about programs today, they typically fall in one of these 3 pyramids, and we'll come back around to that as well. So fourth level on the pyramid is changing the context. And this is really changing the environment or systems or organizations around people so that they are protected from health and that the default choice is healthy for them. Policy systems and environmental changes happen at this level. Things like smoke-free policies, adding fluoride to the water, or linking healthy foods and eating to child care license requirements are all about changing the context. We're changing the environment in which an individual is living. And at the very bottom of the pyramid are socioeconomic factors. These are factors that can affect health, and it could include poverty, education, housing, economic status, job, and other social determinants of the health. So if we can impact these factors that may seem not to be related to health at all, we actually have the most significant impact on that community's health. So interventions at this level have the largest impact on an entire community. As you probably can imagine, they also require a lot of time to get up and running, but kind of with both bottom tiers of the pyramid, as it gets up and running, the change is long-lasting and will be sustainable. So why do we look at policy systems and environmental change strategies? So we Thrive focuses on policy systems and environmental change strategies for a wide range of reasons. Typically, kind of the top three reasons that we look at is that these interventions are long-lasting, they are going to be sustainable, and they're going to last for generations. And so we're not only impacting the current generation we're working with, but we're impacting generations to come. So those are kind of the main reasons. Policy systems and environmental change strategies will take some time and energy to get up and running, but once you kind of have them implemented, then there's minimal effort needed to kind of maintain those changes.
All right, thank you, Mary Ellen. So now we're going to get in a little bit deeper into specifically environmental change strategies. So again, we'll start with some simple definitions, but as we talked about before, environmental changes are things that impact physical changes to the economic, social, or physical environment. They change what you can see, touch, interact with directly. Environmental changes can come about as a result of policy or system changes that happen in the community. They are often very long-lasting. As Mary Ellen mentioned before, they're very sustainable, and once they're in place, they remain there for years to come. So revisiting this pyramid, health impact pyramid, environmental changes like policy and systems operate in the changing the context section. So that's the second to the last tier there in purple, changing the context. Environmental changes can be the result of policy or system changes, or they can stand on their own without either. A community might put a policy in place that requires sidewalks to be built for all new developments. Then when a new development goes in and sidewalks are built, the environment will be changed as well. So that's a great example of seeing how policy and environmental change can work hand in hand. However, a community might decide to update the playground equipment in their park to be more accessible for people living with disabilities, which would change the environment without changing policy. So you don't need policy to enact environmental changes within your community, but they can coincide with one another. So who makes these environmental changes? Who's responsible for this? In general, the owner of a property is able to make environmental changes on a property that they own. It's kind of part of their responsibility as being a property owner. City council can make changes to city-owned property, such as parks, playgrounds, or local roads, and the state is responsible for signing off on changes to state-owned property, places like state parks or state-controlled roads and highways. Similarly, the federal government controls what happens on federally owned land, such as national parks, national forests, etc. Some governmental agencies operate for their own government. The Ohio Department of Transportation, also known as ODOT, controls what happens on state-controlled roads, and the Ohio Department of Natural Resources, ODNR, controls what happens in Ohio state parks. So really this kind of differs between the different levels of government and who owns the properties and kind of who's responsible in that sense. By the same token, local property owners can control what changes happen on their own property. So this can be individuals, people that can make those changes on their properties. It could also be organizations such as churches who have control over their campuses in the same way that schools and school districts can control what happens at their buildings. As we said before, even private citizens have control over changes on their own property and kind of have the freedom to do that as needed. In order to make environmental changes, you need to know who has control over the decisions about that property and get permission and support from those decision makers. The last thing you want to do is to go ahead and make these changes to the context and to the environment without getting permission, because that could be a whole lot of work and energy wasted. For public spaces, it's also a good idea to get input from the larger community as well. The more buy-in you get from the community at large, the better your changes will go over. Sometimes what is popular with one group causes concerns for another group. For example, if you took a city-owned parking lot used by a senior center and made it into a skate park for teenagers, your project would likely be very popular among young people in the community and local business owners who would really directly benefit from that. However, it might be very unpopular with seniors who use the senior center, rely on those services, unless you work together to find other locations or other partnerships to make everyone happy in the community. So again, collaboration is key with these things. So let's get into some concrete examples of these to give you more context. There are many examples of environmental changes, as you can see on the slide. All levels of government can make environmental changes, often by setting policies or regulations which then mandate environmental changes. So as you can see on the bottom, we have some national examples, and then to the right, we have some state examples. So for national examples, the federal government passed, a good example is the Americans with Disabilities Act, which mandates that all public buildings be accessible to people living with disabilities, including ramps, automatic doors, and other accommodations. Most of you have probably seen these, either on the street or in most buildings. In this case, the policy set by the federal government has caused the environmental change to happen. So it's kind of been a ripple effect. That policy kind of built the paperwork and the law to allow that to happen, and then the environmental change really worked with the infrastructure to implement that. At the state level, there are other examples. Ohio lays out specific requirements for things that can affect people's health within the state, like sewage treatment systems or restaurants, and those requirements can then change the environment. This is a lot about the work that we do here at the health department. You can also see certain types of septic systems based on what is approved by the state, or there are other sneeze guards at the face because of food safety codes that were set by the state of Ohio. So those are two different examples of things that can happen based on state mandates. The best example of a good Ohio example is the smoke-free workplace law, which means that every employee in the state of Ohio can go to work and be in a smoke-free environment. So some of these things, especially the Ohio smoke-free workplace law, some of us may take for granted. We don't really think twice when we go into a restaurant and we're asked, if we're not asked, we want to sit in a smoking or non-smoking section. This is a great example of an environmental change that has lasting policies and lasting effects on generations that we don't even have to think twice about for improved health. So now we can talk about some more local examples, just some other examples in general. At the local level, some environmental changes happen without policy to back them up, as we stated earlier. A community might choose to install speed feedback signs in the school zone in order to change the environment and get people to slow down for pedestrian safety. The fire department may have a campaign to install smoke detectors in homes in order to reduce the damage done by house fires. Another environmental change that we all are aware of that has a really powerful impact. The community may also choose to have a prescription drug drop box at their police station in order to allow residents to get rid of unwanted or expired prescription drugs. Schools can also make environmental changes. They're included in those organizations or institutions that can make these environmental changes. A school may decide that they want to put recycling bins next to the trash cans in their hallways, rooms, or gyms to really make it easier for students to recycle. They may also pass a tobacco-free policy and make the environment and campus tobacco-free. Businesses and churches can also make these changes by removing loose floor rugs from buildings to reduce trip hazards for older adults, or they may decide to create nursing mother stations within their organization to help employees or customers build a good breastfeeding relationship with their infants. They may also install bike racks to encourage people to ride their bikes rather than drive to their buildings. So it's really making the environment conducive to these healthy habits that we want people to pick up, whether whoever is going to be there, whether it's an employee, a customer, a visitor. We want to make sure that the healthy choice is the easy choice by implementing these environmental changes. The really important thing to remember here is that any changes to the environment have to be things that you can see, touch, feel, or really a culture shift to be incorporated into environmental changes.
So then the fourth type of strategy that you can use are programs. So we're going to explore programs in a little bit more depth. So starting with the definition, programs are things like events, classes, or direct education that involve working directly with the community or individuals to change behavior and knowledge. Things like exercise classes, recycling events, or other one-time or limited run events would be considered a program. Programs can be used to support other types of change. Programs are most effective when they're paired with a policy, systems, or environmental change, but they can stand alone as well. So if we look back at the health impact pyramid, programs often sit in the top 3 levels of the pyramid. This doesn't mean that programs aren't important, but rather that they require increased time and one-on-one attention to change the behavior of a small number of people. Some programs can work at the bottom tier of the pyramid, looking at the socioeconomic factors. A program that helps people get their GED, for example, would help then individuals get jobs or move up within their company, which then hopefully would lower the unemployment and poverty rates within their community. So for the most part, we're looking at the top 3, but programs can definitely impact or exist in all 5 levels of the health impact pyramid. Programs can be used to support other types of changes, such as policy, systems, or environmental changes. We feel that they're most effective when they're connected to one of these other types of changes. For example, if a community passed a policy that all residents will receive curbside recycling pickup, they might also hold a series of seminars around what type of things that can be recycled and how best to collect recycling in the home. In this case, the policy makes recycling more available to the community, and then the program, the recycling classes, reinforces why recycling is important and helps people gain the skills they need to increase their recycling. Another example might be a community that puts in bike lanes or along a busy road, which is an environmental change. However, they might also want to hold bike safety classes for local residents, as well as for drivers, to help them learn to bike safely along the roads while increasing their skill and confidence. In this case, the program directly supports the environmental change that took place in the community, but then also increases the skills and confidence of the individuals who are biking. If your community, school, childcare, or organization is working on policy, systems, and environmental change strategies, we encourage you to think about ways that programs can support that change. Or if you have an idea for a great program, try to think about ways that that program can be supported and backed up by a policy, systems, or environmental change. So let's talk about some examples. So most programs are implemented at the local level, but there are some examples of federal and state programs. You may notice that many of the higher level programs support policy, systems, or environmental change strategies. So the former First Lady, Michelle Obama, had the National Let's Move campaign, which was a program in which could be implemented in communities, schools, faith-based organizations to get individuals up and moving and getting their 60 minutes of physical activity a day. Locals could adopt and take the program materials developed by the national campaign and implement them within their own community. Medicare and Medicaid are examples of national programs that provide health insurance and support to the elderly, as well as low-income individuals and individuals who may have disabilities, as well as families and children. The Energy Star program, run by the Environmental Protection Agency, looks at appliances to rate their energy usage. This then helps consumers make better informed choices and to be able to identify appliances that will use the lowest amount of electricity within their home. Game On, which is a program from Action for Healthy Kids, is again a national campaign that local schools and child care centers can take and implement within their own school environment to encourage their students, staff, parents, and community members to increase their physical activity throughout the day. At the state level, we see the Step Up to Quality program. This is a program for child care centers that includes policy changes and changes to the environment. It is ultimately a program, though, that supports and is supported by policy and environmental changes and encourages child care workers to receive additional training and improve their care. Families then can use the Step Up to Quality stars and look at identifying potentially higher quality child care centers for their students and young ones to attend. The Ohio Quit Line is a program that supports individuals' choices to quit smoking and provides cessation support. And the Healthy Home and Lead Poisoning Prevention Surveillance System is available to help provide information to locals on ways to create that healthy home environment and to prevent children and families from experiencing lead poisoning. Again, as a program, it offers educational and other program materials that can be implemented at the local level. There are many examples of programs that happen at a local level. So we're going to talk through a few of them today. So Forest Park has started a free community boot camp program to get residents working out and moving. Residents are able to attend these classes on Saturday mornings at no cost. Amberley Village holds an annual one-stop drop event to help people recycle certain items and keep them out of landfills. Anderson Township holds a bike rodeo to help kids learn how to bike safely within the township. are also educational programs that are great examples at the local level. So this could be partnering with OSU Extension and their nutrition education program, or partnering with Hamilton County Soil and Water, Hamilton County Department of Environmental Services to provide educational programs on recycling, water and soil conservation within schools and other community events. Churches can serve free community meals that are open to anyone who might need a good meal, or anyone who wants in the community that wants to hang out and enjoy some social time. The Reading Auckland Presbyterian Church has partnered with community organizations to hold free ballet classes for kids in their community, giving these young teens and girls a chance to dance without having to pay. Susie DeYoung of LaSoup, a program called Cincinnati Gives a Crock, where she goes into schools and teaches kids basic cooking skills on how to use a crock pot so that they can cook meals for their families at home. Many schools hold after-school tutoring programs to help their students with homework. Excuse me. Some of these programs are backed by policy systems and environmental changes, but not all of them. As you kind of look at the work within your We Thrive community, school, child care center, recognize the important role that programs can have, but then also make sure that there are those larger sustainable changes that are happening as well to support the program. Programs don't have to be large, big, complex programs. They can be simple as sending information home to families about the new fruits and vegetables that were served to the students at the child care center that day, or new physical activity games that parents can try to have or incorporate into their family time as well. So don't always think that it has to be these big scale grand programs. You can definitely do things on a lower scale as well.
Thank you, Mary Ellen. So now we're going to wrap it up. We went over a lot of highlights and examples of environmental changes and programs that support policy systems and environmental changes, but let's kind of wrap it up and bring it all full circle together. So just to review, we stated that policy changes are interventions that impact laws, ordinances, resolutions, mandate regulations, or rules. They can be formal or informal and are usually written down in some form or fashion. So kind of on the books, as we say. Things like resolutions, ordinances, laws, or rules are all examples of policies that can be made or changes. Systems changes impact all elements of an organization, institution, or system. So this could be a school, a police department, a business, a nonprofit organization, etc. And system changes change the way things are done throughout the entire system, and often they change the infrastructure of an organization. Systems changes can have a large amount of overlap with policy changes, such as a breastfeeding policy, and then an organization chooses to change that system by creating a space for breastfeed that then nicely coincides with the policy. They can be hard to tell apart sometimes, policy and system changes, but they often work hand in hand to accomplish a goal. Environmental changes are things that impact physical changes to the economic, social, or physical environment, as we've covered throughout this presentation. They change what you can see, touch, interact with directly. Environmental changes can come about as a result of policy or system changes that happen within a community. They are often very long-lasting, and once they are in place, they remain in place for years to come. Sustainability is a really big part of this. And then lastly, moving on to programs, we stated that programs are things like events, classes, or direct education that involve working directly with the community to change behaviors or knowledge. Things like health fairs, exercise classes, recycling events, or other one-time or limited events would qualify as programs. So some events are held quarterly, some are just once a year, and so they really don't have as much of a long-lasting impact, but they're still very important to supporting those policy systems and environmental change strategies. Programs can be used to support other types of changes as well. Programs are most effective when they are paired with policy systems and environmental changes, but they can stand alone as well. And revisiting this health impact pyramid once more, we see that, or remember that programs often operate in the top 3 tiers of the pyramid. So that's counseling and education, clinical interventions, and long-lasting protective interventions. Policy systems and environmental changes operate in the 4th level of the pyramid, which is changing the context, or working to make the healthy choice the default choice, or the easy choice. One of the reasons that we focus so much on policy systems and environmental changes within the We Thrive initiative is because when we change the context for people, we can have a large impact on the population with a smaller amount of effort. So really this is looking at population health rather than individual health that can really affect a lot of people without a ton of money or resources. Usually that happens. The changes that are made may be more sustainable and use less time, money, and people with power than programs or direct interventions. This does not mean that programs are not important. As we stressed before, they do play an important part in the health of a community, but rather when resources are limited, sometimes it might be better to focus your efforts on larger policy systems and environmental changes so that you can have a greater impact. The goal is to really help as many people as possible by making their environments and living situations and experiences healthier and easier to make those healthy choices. So that wraps up our presentation. We do appreciate you being with us today on this webinar presentation. Here is our contact information. If you have any questions, you can go ahead and type them in the chat box to the left of your screen. You can also contact us afterwards if you come up with a question and you really just want to learn more about this topic. So go ahead and type a question if you have one on the line, and we'll be happy to answer those. All right, well, it looks like we don't have any questions. Again, thank you so much for your time and tuning in today for our second part of the Policy Systems and Environmental Change Strategies webinar.